No, you're good.
Hi, welcome back to Guide to Surviving Stroke and Brain Injury. Today I'm with Dr. A.J. Wilson. I'm so excited to have him. He helped me regain some of my strength back in my eye and started me on my balance. I would still be seeing him, but unfortunately my insurance doesn't pay for it and I can't afford to see him. Or else I would still be seeing him. As you can see, I called him Doogie Howser because he's so young. Are you 33?
I am.
Oh my God, you've accomplished
And
so much.
I didn't shave all week just for this, just so I could have a little bit.
You still look young, sorry.
I know.
So thank you again for doing this. I really appreciate it. So I just want to go over some of your background so people understand how many degrees you have,
Okay.
which is kind of crazy. So correct me if I'm wrong or update me if you've passed some of these.
Okay.
So Dr. Wilson grew up in a church and developed a relationship with Jesus Christ. While he attended CSU Pueblo, he decided to become a chiropractor. In the fall of 2008, he moved to Dallas, Texas to finish his undergraduate work and start the chiropractic doctorate program from Parker University. He started the chiropractic program January of 2009. In 2011, he graduated magna cum laude with his doctorate in chiropractic and ranked third in his class. He also obtained a bachelor degree in health and wellness, as well as a bachelor degree in anatomy. He is currently continuing his passion and getting a diploma in functional neurology and eventually a master's degree in neuroscience. He is currently working on obtaining his fellowship from the International Academy of Medical Acupuncture. He has certifications in thyroid dysfunction and has almost 200 hours of functional neurology training. His motto, which I love, by the way, is Luke chapter 9, verse 2. He sent them to proclaim the kingdom of God, and he healed the sick. So I love that. Pretty impressive.
Thanks.
I can't believe you did that all and you're only 33.
I'm still working on some of it, so.
Well, makes me feel lazy. So I'm assuming your specialty is in neuromuscular medicine?
I do a lot with the neuromuscular, and then I do a lot with functional neurology and functional medicine as well.
And that's how you got involved with me, right?
It is, yeah.
So stroke is a type of brain injury, right?
Correct.
So you deal with brain injuries, strokes, and what else?
I mean, I try to incorporate it into every patient's care, whether it's, someone just coming in after a car accident, or even just, for sports improvement or anything like that. We try to incorporate the brain into the healing because the brain controls the body. And so we start looking at the brain and balancing it and trying to get some of the areas that aren't functioning as well functioning better, so that way we can kind of increase that overall improvement within the body, whether you're, recovering from a stroke or a TBI, or, you have a mild whiplash case, and we're trying to regulate some of that even too.
So a TBI is like a concussion. It's a blow to the brain, right?
Sure. So a TBI is just a traumatic brain injury. So a stroke, a concussion, all of those are technically considered a TBI, but you can have different degrees of it.
Okay.
So that's why you have even like a TIA, a trans ischemic attack. It's not as bad as a stroke, but it's still technically, dealing with the brain and that brain injury.
Well, those are mini strokes, right?
Right, and that's essentially why they call them mini strokes. Is it's the same mechanism, but it may not have been as detrimental to your life, or it might not have had the effects that a full-blown stroke could have had. So that's why they call them the mini strokes. But when you start looking at mechanism of injury, where at in the brain it's affecting,
how much damage is done.
Right. So to me, I look at them pretty similar as far as treating them the same way. you find out what areas are not working right and how can we improve the function of those areas, basically.
Now, is knowing where the stroke affected the brain important?
Yes. So in a couple different reasons why. So and that's why you see some people, sorry, I keep seeing my hand fly. I talk with my hands a lot.
So do I, so it's okay.
So that's part of my thing. So yeah, and I mean it's completely different. I mean, if you have a stroke on one side versus the other, versus a brainstem stroke versus cerebellar stroke, they're all going to tell you different things. Now, some can affect you more than others. When you start looking at language or walking or talking or different things like that, they can affect you differently depending on, one, the amount of area damaged, and two, the area that was damaged.
Yeah.
So it does help, if we have imaging or different things like that with it. But I still like to do the exam so that way we can start seeing functionally things and maybe see those improve before we might see things improve on an MRI or a CT or something like that as well.
I know you're on your way to a neural diaphragm, but what does that specifically mean?
As far as what?
What does that mean? Because I know it's something to do with, you're not a neurologist yet. You can do everything but surgery, right?
Not necessarily. So functional neurology versus regular neurology is a little different. Okay, so when you take a traditional medical neurologist, they're looking at a lot of imaging. They're diagnosing a lot based off that imaging, especially with strokes or anything like that. But you can take something as far as, let's say, a hemiplegic migraine. Okay, so you
Which
can
I
have
have
someone
before.
who gets right. So you can have someone who gets a migraine and it causes paralysis in their body,
Yep.
but yet it's not showing up on the imaging quite the same. So it's a little harder to diagnose, and that to me is where functional neurology really shines, is because we can take that exam and go, okay, we're seeing a weakness on part of the brain here that could be contributing to a hemiplegic migraine. Or then you start looking at, okay, so can we bring that area of the brain up in function without exceeding that threshold, of basically that integrity level of where the brain resonates at and functions at, and we don't over exceed that ability and just, completely fatigue somebody, but we can start working them out. So I compare it to a workout. If I can bench press 100 pounds, and you throw 200 pounds on the rack, it's going to crush me.
Right.
But if we start going, okay, if 100 pounds is my max, I'm going to start doing it at 50 or 60 or 70 pounds and really work that hard. And then that 100-pound max should gradually increase. And so it kind of has the same thing with the nervous system and the brain, is we can start off doing, different exercises that aren't going to fatigue you, and then kind of gradually increase that. So now your threshold, instead of being here, is now up here, and it won't fatigue those neurons quite the same.
Can I just say what you did for me fatigued
Sure.
me?
Sure.
So I know you say it doesn't, but everything you did really tired me out big time.
Yeah.
But it was good because I'm now where I am now because of you.
Sure.
So
Awesome.
Thank you.
I appreciate it.
How and why did you start this journey with neuroscience?
That's kind of interesting. I actually, when I was in undergrad, I had a psychology class, and it dealt with the brain some, and I hated it. I absolutely hated it. I didn't understand it. I didn't understand the areas of the brain. It was probably one of my least favorite classes. And then when I got into chiropractic school and got into anatomy and neuroanatomy, and we're actually dissecting those areas, and we have cadavers and we're actually looking at the brain and areas of the brain, it started clicking, and different areas of the brain I really started to enjoy, and it started making sense. So I could visualize it completely different, actually having put my hands on it and seen it, compared to just trying to read about different things in a book, and I didn't understand where it was taking place in the brain.
So yours is more tangible. You wanted more tangible
Correct.
than thought.
Yeah.
That's
So,
cool.
you know, for me, it was like, okay, if I'm talking a speech center and it's in the, you know, in the front of the brain versus the back of the brain and different things like that, I couldn't visualize that
Right.
during my undergrad, and it drove me crazy. And then when I actually got into neuroanatomy, I actually liked it so much that I became a teacher's aide for neuroanatomy.
Oh, wow.
So I really enjoyed it and, you know, got into it there. And then I started getting into more the functional aspect of it too. And that kind of just became what it is now, as far as taking extra classes and learning as much as I can about the brain and the nervous system. And
So do chiropractic and brain injuries go hand in hand, or are they totally different?
they should, in my opinion. So the where chiropractic really shines as far as neurology goes is we can affect the spine to constantly give a stimulation up to the brain. So, and that's actually part of the reason why chiropractic works so well for
Mm.
pain and, you know, muscle injuries and some of that musculoskeletal stuff, is because when you actually look at a gait theory, so gait theory is basically saying that all of those small fibers running up to the brain are carrying pain and some other things, but mainly
Right,
pain.
they're
You know,
receptors.
that's the one we're concerned with, at least. And then you have the large nerves that go up to it that carry more of the proprioceptive, where the joints are, where the muscles are, stuff like
Mm.
that. So if the joints in the spine aren't moving properly, it can't stimulate those pathways as well. And then the small ones can take over and just continually stimulate the brain and cause pain. So
Wow.
that's where chiropractic really shines, you know, and there's some misconceptions with how effective it is, but this is the way that I've explained it to people, just because it makes the most sense after
Yeah.
learning some neurology, is going, okay, now we've restored movement in that joint, and now every time you're up moving, you're walking, whatever it is, it's now stimulating those large nerve fibers that's dampening the pain and restoring the motion and movement in that area, basically.
That's awesome.
So
I've
it's
never heard
fun.
it
I like
explained like that before,
Yeah.
ever. So how many cases of brain injuries and strokes have you done?
As far as an exact number, I'm not sure. I would probably say it's, you know, at least a few dozen or so. You know, just as far as, it kind of depends on those varying degrees too. So like I said, I
Right.
incorporate it with everybody, but it's kind of, okay, how extreme are we going? Are we going a full stroke to where it's affected your body type thing? Or, you know, I get a lot of whiplash injury cases as far as those, because, you know, again, the mechanism of injury is one of those where it's, hey, you know, I was in a car accident, or I was playing football and I, you know, got hit real hard, got a concussion, you
Right.
know, different things like that. Which surprisingly, I actually see more concussions from soccer players than I do football
Really?
players. I
Oh
do.
no. Because the
So
helmet
I don't
or
want my kids playing soccer because because I see so many head injuries from those.
that is
So
crazy.
it is. Now I
Is it
have
because of
seen
the
the
helmet?
worst. I don't know if it's because they're, you know, hitting the ball with their head that hard sometimes. I mean, that ball's not the softest, and you get someone kicking
Right.
it at you, and then you're hitting it with your head. So, you know, I've seen some of that kind of stuff. Now, the worst concussion I saw wasn't a football player.
Mm.
But as far as the amount and number, I actually see more with soccer players than I do with football or any other sport.
And you know what's weird is they don't see a concussion as a brain injury, but it is.
And most people don't, right?
And
And
it
so,
doesn't go away
well, and the thing
unless
you
you
have to
treat it.
look at, to a certain degree, yes, but the thing you have to look at with really any brain injury is the more you get, the more susceptible you are to more.
Oh, I didn't know
So,
that.
yeah, so they can actually compound on
Hmm.
each other, especially with concussions. So if I got hit once, you know, and then I got a concussion from that, and I got hit the same amount, you know, of force, it can actually cause a worse brain injury, you know, concussion wise, because of that same force. So because you already have damage there, you already have basically an immune response that's primed and ready to fight if something happens, and that can actually cause more issues in the long run too.
Wow. I did not know that.
So, and that's why I like the functional medicine aspect of it as well, is because if we heal the brain all day long, but yet we're not doing things nutritionally to support the
Right.
brain and function, then it's not doing as much good, and vice versa. If we heal the gut and everything, or the,
The
whatever
heart.
metabolic condition it
Right.
is, and yet we're not affecting the brain and balancing that, then we're not getting the effects that we need to, as far as maintaining that.
Right.
So they
So
actually have research that shows that you can actually reconcuss your brain based off of your gut health and eating gluten.
how weird, really?
It can actually cause an immune response that will actually be the same immune response that you got with the concussion, but it's from something you ate.
That is crazy.
Yep,
Our body is so intricate. It's
it is.
amazing. And
It's
I bet
very,
there's still stuff we don't know
oh,
about it.
tons of, yeah.
That's crazy. So you not only had to deal with my stroke issues, but you also had to deal with my vision issues. Um, you did it safely and effectively. He was always there with me, always. He made me take risks, but he was there with me always. And if you remember some of it, can you go over some of the exercises, either visually or stroke issue wise?
Sure. Yeah, so we can do some of that if you're all right with it. So the one thing that I do try to do, and I kind of mentioned it already, is I try to get all the information I can from that exam. Okay, so then we try to tailor more of a plan to it. Okay, so I know with yours we were working on some strength with one side versus the other, and then that actually correlated with some of the visual stuff too,
Oh, it did.
because of the stroke, and you lose some of that. You're changing the way the muscles function with the eyes as well, and that's where some of those exercises came in. And the thing is, though, too, is especially with what we were doing, when covering part of the eye, or because we were wearing glasses and then covering part of that visual field in order to cause your eye to pull differently.
Right.
And so the thing that's difficult with some of that too, and I remember talking to this with you, is some of that fear and anxiety that can come up
Yeah.
with the treatments that can happen too.
Well,
So
until
I
my
put you in
balance,
uncomfortable positions.
right. My balance wasn't good because of my eye too. I mean, yes, the
Sure.
stroke, but I mean, my vision had an effect on my balance anyway.
Oh, 100%. Yeah.
So it was a stroke and my vision that messed up my balance. It still does. But here
Yeah.
are some of the, can you see it? Let me see.
Yeah, I can see it. You still got them. Look at that.
I do. And trust me, I look like a pirate for
See,
2.5 years. Here's my
bigger
patch.
and then kept going smaller. Yep.
Yeah,
And that's
thank
what you came
God.
in with
What's that?
that's what you came in with was the patch.
I look like a pirate.
That's right. We just had to get you a hook, and then you would have been all right.
And a parrot.
That's right.
But how are you able to get the idea of shrinking the dot on my glasses?
I'll admit it. I'm weird.
You're not weird. You're out of the box thinking.
I'm out of the box a lot of times. But to me, that's what's fun. Okay, so I try to take things that we can.
And plus, two, he liked making me look stupid.
Well, no, I didn't. But that's the fun part for me is if we can come up with something that stimulates it, or basically that can change the way it's functioning. It doesn't matter how silly it is sometimes,
Right.
if it can still accomplish the purpose, and do it. I mean, I have people balance on one leg and swing their arm around, and it's like, I feel like I'm crazy, but then you explain to them why you're doing it.
Right.
And he goes, oh, well, that makes sense. So basically the reason why we started with the tape and blocking that vision off and stuff was to get the muscles to balance. And basically we were getting conflicting information from each eye,
Right.
but only part of the eye. from what I remember, it was more that focal and central vision
Yeah.
compared to the periphery. And
Right.
so with dealing with balance, we were looking at, okay, three main things tell you where you are in space: your visual system from your eyes, your vestibular system from your ears, and your proprioceptive system from all of your joints and muscles. Well, when you have a stroke that knocks out two of those, well,
Right.
really, in your case, it was all three of them were
Yeah.
affected. Now you're kind of up a creek without a paddle and going, I don't know which system to trust,
Right.
whether it's my legs or my ears or my eyes. And so we had to take all of the information we can from those systems and try to get them to sync up. And so because the eyes seeing that depth perception was off, but not as much in the periphery, my goal was to basically block the center of that part. That way you couldn't get the double vision and stuff amplified quite as much, and it would cut down on some of that. But yet we still had enough of the peripheral vision to help you not run into things and kind of
Right.
support that balance aspect.
Because I was crashing into walls and
Sure.
doors, and because I couldn't tell, honestly.
Right. Well, when you can't see, and part of it is the balance aspect, and then the other part is you walk around covering your eye, you can't see that part as
Right.
far. And so we started, working with that patch and then shrinking it, and we kind of pushed that boundary of that threshold a little bit with that. I know too is it's like, okay, we made it as big as we comfortably could without you getting some of that double vision.
Right.
And then we would shrink it a little bit smaller and smaller and smaller. And I know, part of that was so you can function and get through some of those, daily activities that you
Plus,
needed
I
to
could
as
watch
well.
TV and maybe able
Right.
to drive. I mean,
Without
it
getting
benefited me more than it did vanity-wise.
sure.
But now,
But it's
because
worth
of
it to look
him,
crazy for a little bit and try to progress through things
for
compared
2.5
to,
years.
still wearing things. So
But I'm bad. As you can see, let me take I look pretty normal.
yeah.
Because before this, I was way over there, right? And
Yep.
they said I'd never wear prism glasses, and now I am.
Cool.
Thanks to you. It's because of you.
That's awesome.
And plus, two, he had me put on this dot an arm's length away. I had it on my refrigerator, and he said, stare at it for 12 seconds, about 3 or 4 times a day, or whenever I went toward the refrigerator. And man, it was so hard at first, even finding the dot.
Right.
And then he had me stare out a window, I believe, right?
We did some of that, yeah.
Close and far away.
Yep.
And that was hard. I mean, everything you did was challenging, but obviously it helped me.
Yeah.
It
Well,
really
that's awesome.
did. So, the other thing I want to talk about unconventional, he had me crawl on the ground with my head up. You remember that?
Yep.
But I want to tell you, that was hard. I mean,
Yeah.
getting down on the ground, first of all, was hard. And then crawling down, and then my dog wanted to play with me. And AJ is like, well, play with him. I'm like, that is too much stimulus.
And it can be sometimes, for sure.
Yeah. And so another thing he had me do was get on all fours and do opposites, like my left arm and my right leg out.
Yep.
And first he had me touching something so I wouldn't fall, and on carpet so it wouldn't hurt so bad. And then progressively I let go of the couch, and that was challenging.
Yeah. But how much self-worth and confidence did you have as you started progressing and making some of those little steps?
When I could do it, I laughed. Unfortunately, I lived by myself, so there was nobody to celebrate with me. But I was like, yes, I did it.
You come and celebrate with me when you came in and talked to me, though.
Every time. Every time. You're right. But it means more in the moment.
It does.
But I mean, those victories, that's what I'm saying. Celebrate every victory, small or big, because if you don't, there's nothing to motivate you to the next level, right?
Yep.
And then Dr. Wilson also had me do a trampoline with him there, but he didn't hold on to me. Remember that?
Yeah.
And a ball. I remember a ball.
I think part of that, yeah. That was with holding it, yeah.
He was mean. I thought sometimes he was really mean, but everything he did helped me. Everything.
Well, good.
But my friend Jessica, who I do the channel with, she
Okay.
would like to do those balancing things like you said, but her wrists are really weak too because of the stroke. Any
Sure.
idea of how to build those up?
It kind of depends on the cause and what's going on with it. Sometimes I have to modify it though. Like sometimes people, they've had a knee replacement and they can't get down on the knee or
Oh,
something like
yeah.
that. So I'll have them do it on a bed or have them do it to where they're laying on their stomach on the bed and they can still raise their arm and their leg, but they're not necessarily getting quite that same degree of support and stability, but yet it's still activating some of those cross-cord reflexes still.
Right.
And
And
that's
that's
essentially
true
what the
because
crawling is.
that's why you do opposites, right?
Right,
Is because of
right.
the brain crossing, right?
You bet. So we're basically working on balancing the brain in doing some of those, opposite type movements like that. And that's where the crawling came in. There's a reason you crawl before you walk. When you crawl, you're working on those cross-cord reflexes and balancing that.
Yeah.
And then as you walk, you incorporate those same movements. Well, a lot of people start losing those cross-cord movements as they walk, and that can affect their stability and their balance and coordination. And so that's one of the reasons why we had you go back to crawling, was to basically re-stimulate those primitive pathways, essentially, that when you have an injury like that, it can completely wipe out some of that function
Yeah.
and, some of those things going on.
And without depth perception, it was very challenging.
Yep.
Because I'm only going to tell you this, I probably already did, but I'd run into couches because
Sure.
I wouldn't know how close they were.
Right.
And the entertainment center, my coffee table, there was so many times I'm like, I'm glad nobody saw that because it was embarrassing. So what suggestions do you have for people that don't have balance like I did?
Keep working on it. For
Always
sure.
strive. Yeah.
Yep. Always. And the thing, and I know we had some talks about this too, when you're talking that maximum medical improvement. So that MMI is kind of a word you hear a lot, especially when people have had a very bad stroke or bad accident,
Yeah.
Different things like that. You hear, okay, what is your maximum medical improvement level? And that's what more like the hospital goes off of, or some of the, more traditional medical neurologists go off of, because they're going off of what they've seen research wise as
Right.
far as, okay, you're improved, you've been at this level for so long, that's probably the best you're going to get. Okay.
Which I don't agree with.
I don't either. And to a certain degree, at least. Okay. Now some people,
You get faster in those first 6 months,
sure,
but it doesn't mean no progress is going to be made afterwards.
correct. So it doesn't mean don't quit, basically.
Right. Exactly.
And that's where people can get discouraged though too. It's like, I'm coming up on that year mark. I'm not where I want to be. I'm getting discouraged because I'm not where I want to be, but I'm so close to that year, and I'm afraid I'm never going to get over some of those humps.
Yeah.
And so that's one of my biggest, not necessarily criticisms, but encouragements is don't let that number be such a determining factor in your progress that you go, okay, I hit a year, there's nothing else I can do, and you
And how many people believe that?
Oh, a ton of them.
I did.
Oh, for sure.
I mean, honestly, I'd rather have them say, you're going to hit a plateau probably at 6 months or a year.
Sure.
Because a plateau is different than you're always going to be this way for the rest of your life, you know? And no offense, but it's like covering their ass since they say that, because if you don't improve, then I told you so. If you do, it's a miracle.
It is.
Well,
but I mean, and I kind of told you this too, is I don't know, because of what I do, okay, it's different for everybody's different. And so I kind of told you up front, or at least I hope I did, because I'm pretty sure I remember this. I didn't try to promise anything.
No, you didn't.
I didn't want you coming in here thinking, okay, I had a stroke, it was a very severe stroke, and now he's gonna get me back to 100% within a week, 2 weeks, a month, a year, any time frame. That's not my goal, okay? My goal is can we give you more good days than bad days, first of all? And that's with all my patients. Can we get you more good days than bad days? And can we start improving that function and that quality of life?
I think I went
that's
into
where
it
it's tough.
like I was at my wit's end. I was at the end of the year, and I thought, is this it for me? I'm so young. I was 47 when I started seeing you, and I'm like, this can't be it. So I think I went in with realistic thoughts about it, like, can he help me look less drunk? Can he help me with my vision a little bit? Because I didn't want to believe that that's how it's going to be for the rest of my life.
Yeah.
And so the improvements I made, because I thought I really improved seeing you.
Sure.
They motivated me to keep going. I didn't stop,
And that's why we try to celebrate those little victories too.
Yes.
Something that may seem really small and insignificant to somebody, like clapping.
Oh.
I remember that being a big one. It's tough.
It is.
But you don't think about that because it's like, I can have a little, 8-month-old that can clap. Well, yeah, but they're developing completely different. And so you take something that's as simplistic as clapping, and when you actually break down how complex it is,
it's very,
it's harder than people realize and give it credit to. Now you take that person and now they're able to even clap a couple times or a few times.
It's exciting.
That's a huge victory at times.
Yes.
And so you have to celebrate those, even though it may seem insignificant or very mild compared to somebody else. I guarantee you, if it's affecting your life and it changes something you can do, it affected you tremendously.
And once I overcame that hurdle, I wanted to do it more. And I think that helped because I'm like, I can do this now. I'm going to keep doing it. Right. And so rewiring my brain was so important to me because I could do it finally. Like the other day, I don't know if you watched my last video, but I always march or do something that my exercises while I'm cooking and stuff. So I was marching, and then all of a sudden my elbow went to this knee. And I'm like, holy crap. So I did it, and I was marching like this. I'm like, yes, that was the first time that I've done that in 3.5 years.
That's crazy.
That was exciting. And of course, nobody around except my dog, but it was exciting. So I do it now every day because I can.
Yeah. That's awesome. Yeah, and you have to celebrate those victories.
Yes.
Because if you don't and you go, oh, cool, I did that, but you know what? It's not where I need to be, or it's not where I want to be. Okay, well, maybe it's not. But it's at least a stepping stone in the right direction.
Yeah.
You're still progressing. And that's where I tell people is continually try to progress, because you're either progressing or regressing.
Right.
And if you're not progressing, you're regressing. And so how can we continue to get you moving along and progressing compared to, backsliding essentially and not functioning as well?
Well, the body in motion stays in motion, in my opinion.
Yeah.
And you gotta keep lubing up the joints. And where'd you go?
Sorry, I probably cut out a little bit. I got a phone call onto my iPad and it started cutting out.
I'm almost done. So, so acupuncture. I noticed you're pursuing acupuncture, getting your diploma. So it's sometimes used for tremors, right?
Yeah, you can. It kind of depends on what you're doing it for. So I still like affecting the brain the best for tremors. But when you start looking at how it can affect the muscle spindle and balance some of that, it works great for, different things affecting the muscles. And then when you actually get into some of the, you can start affecting different areas in the brain from acupuncture too, not just on the brain, but within the body too. And so you can cause, better circulation to those areas. You can cause the muscle balance to affect a little bit different. If you have a spasm.
The messages to it?
It can, to a certain degree. It kind of depends on, if those areas have been damaged or where they've been damaged too. So
Because I have right side tremors, but I thought about acupuncture because if my fine motor skills are not
sure,
where they need to be.
yeah,
Now I have a lot more use in my arm now, but it's the tremors of
the
writing
writing,
and
yep,
eating and stuff like that, and I crush everything. And I would like to see some of that desist a little bit
sure.
if I can. Do you think acupuncture would help?
It's hard to say. I mean, I definitely don't think it would hurt anything. And depending on what, like, there's lots of different styles, I guess you could say too. And that's what I'm finding too, is it's kind of like what style, how far do you want to take it? To me, I don't get into as much of some of the energy areas as some other people would like to, just because
Like the
that's
TENS machine, or what are you talking
no,
about?
as far as like energy with like chi energy and
Oh, I see.
some of the energy, acupuncture theory energies, with traditional Chinese medicine and stuff. I don't get into quite as much of that, mainly because you can really easily slide from, doing different energy things, and it can go into different, thoughts as far as more religion wise, or, kind of blurring lines that I'm comfortable with some of that. And so I don't get into some of that. I use it more from like a structural musculoskeletal standpoint, and affecting it a little bit more like that.
Do you suggest I should try it?
I'm not opposed to it by any means. If you wanna talk about different people, around that we can kind of talk about too. I can look up a couple
Well, I
people
know
and let
Justin. Does
you.
Justin do that?
He kind of treats it more like how I was doing it when he was doing it, as far as more the musculoskeletal aspect and stuff. So,
I might give
but I
him a
have
call
a
then.
yeah, but I have a couple other people that I like too.
Okay.
One lady, she does a really good job. I have a few patients that see her,
Okay.
and she does a really good job. And so yeah, I
And
can send you
acupuncture
her. Sure.
does not hurt. Please tell
It
everybody. I
doesn't,
know it's needles, but it doesn't hurt.
right? Not like people think. It's a
No.
really small needle. I mean, half the time you can't even feel it going in.
Right.
So it kind of depends on what you're doing. Now, if you're looking at more of like a dry needling aspect or some of that, that can be a little more painful and uncomfortable. But again, it's what purpose are you trying to accomplish with it? And so that's where it can really work well to balance some of the muscles and,
Right.
some things like that too. But yeah, to me, I still like to go to the brain first, just
Right.
because that's the area that I like the best, and that's where the main injury happens. So if I can start increasing that area, then sometimes I can do that a little faster than what my knowledge is, at least in acupuncture.
Right. If people can't afford this help, what would you suggest they do?
Call me. Call me for sure. There's I
That's
know,
true, by the way.
to me, I mean, the first visit is the most expensive and it takes the longest, but it also gives us the most information.
Right.
So if we need to do something to where it's like, okay, so my initial visit takes an hour, and we go through the consultation, the exam, and the first treatment all in that first visit, and the price for that is 120. So if we need to break that up a little bit different, and we do half now and half later or something like that, then I'm not opposed to doing stuff like that. I would rather see people go through that length of an exam and not cheapen the service as far as
Right.
going, all right, I'm going to just work on you. Well, if I don't know what to work on, what am I going to work on you
And you could mess up other things too
with? Oh,
while
for
you're that.
sure.
Right.
Right. Had we patched your other eye or something like that, we
Oh,
could have completely changed things.
yeah.
And so that's where it is very important, in my opinion, to go through a very thorough examination. My intake forms are like 7 or 8 pages, so that aspect in itself is lengthy. And then you throw in, the exam on top of it, it can be a very lengthy process. And so I don't want that to determine somebody, just the price factor.
Right.
So if they're really interested in it, we need to do something, call me. We'll talk about it. We'll see if we can come up with an arrangement, a plan of some sort to where we can at least get through a few visits and start, giving them things that we can do. I know we
Right.
gave you a lot of exercises that you could do at home, and it sounds like you're still doing some of them, which is
All of
great.
these are.
Right.
I saved
So
all of them, and I still do them.
perfect. So I do try to give people as much as they can do at home.
Yeah.
There's certain things you can't do at home. I'm sorry, you can't.
No, it's true.
When we start working with the correcting of the spine and getting some of those nerves stimulating, I like cold laser. I do different things with that, and some different things called microcurrent, different things that you can't do at your house that I
Right.
can do here. And as far as learning some of that threshold in those areas. So if we can at least get through a few visits and start, kind of figuring some of that out and going, okay, these are the things you need to work on. These are how often you need to work on them. Once
Right.
you start mastering some of those and progressing with that, then it's like, okay, I haven't seen you in a month. You come back in and we start working on it again. And so it is definitely more of an upfront cost, but hopefully we can start spacing things out to where if we do need to do something, as far as a treatment plan or payment plan or anything like that, then we can make that happen.
Well, I just want to say, you helped me. Everything he's saying is true. And once I got to the point where I couldn't afford it anymore to go, he gave me a whole bunch of things to go over to do, and then after that. And so I can't thank you enough, because you gave me hope again. You really did.
Well, awesome.
You really did. And I don't know if you know that. I mean, I think you kind of do, but you don't know the extent.
Sure.
And you're life changing. You're changing lives. So I appreciate it.
Well, I got to give God all the glory. I mean,
that's what I was just going to say.
He deserves the credit. So I definitely know he put me where I needed to be with this, but I mean, he's the ultimate healer. So he's in control of all of that. And if he wants to use me as a pawn or a tool or whatever you want to call it, then by all means, I'm willing. But that's, he's ultimately the one that gets all the credit. So.
Well, and I think that's one of the things you told me that too about him, is because I was crying to him one day, and I was like, he talks about miracles in the Bible all the time. And Dr. Wilson said, he never promised an instant miracle to you. Sometimes miracles take time. Sometimes they're miraculous. They happen in an instant. But in your case, maybe one day you'll wake up and you'll be healed. You never know. But for now, this is how he's healing you, because that changed my perspective on healing big time.
Sure.
Big time. And God has always been with me. He never left me. It's in Christ who strengthens me that I do the things I do, the risks I take. And, I believe that God sent me you. Because out of all the people, how in the world would I have found you? Right. Honestly. And I mean, everything is God, and glory to God for everything you do and have done and will do. And I just am so appreciative to everything you've done for me. Seriously.
Well, thank
I
you.
really am.
Thanks for asking me to do this. I appreciate it.
I'm so glad you agreed to it.
Of course.
Is there anything else you'd like to add?
No, I don't have anything except for, just keep going and take one day at a time.
And I want to say, remember to celebrate every victory again. It's so important. And do every exercise safely. Whether it's your physical therapist or your doctor or whoever, do it safely all the time. And never give up, because you never know. You never know. So Romans 12:15 says, rejoice with those who rejoice and mourn with those who mourn. And I think that's what our doctors do for us. The special ones, anyway. Well, thank you again, Dr. Wilson.
Of course.
I miss you so much, and thank you again for doing this.
Well, if you need anything, let me know.
I'm definitely going to call you about the acupuncture though, because
Sounds good.
I'm definitely interested in that.
That'll work.
Okay, have a great day.
Thanks,
Thanks
you
for
too.
joining us. Bye.